Dr. Fahad Razak. He is a member of Ontario's Science Advisory Table and an internal medicine physician at St. Michael's Hospital. Good to have you on the program, and I appreciate your time today.
Good to be with you.
So, we've been covering this, as you have, very closely in the last couple of weeks as we've seen the numbers go up. Now, the Science Advisory Table warned weeks ago strict measures were needed in Ontario to control the third wave. Now we're at the highest numbers we've ever seen here. What's the situation? What do people need to know, Dr. Razak?
Yeah, it's a really dire situation, and unfortunately, the best prediction that we have is it's going to get worse before it gets better. The die has been set, as they say. The cases we're seeing today are cases of people who were infected in the last few weeks, and we're going to continue to see that rise now, probably at least for the next 1 or 2 weeks. Hopefully it plateaus at that point, and then it starts to decline. And we did see a very good response during the earlier wave to a lockdown, and so hopefully that will start to protect the system. But the next few weeks are going to be very critical.
Given what we've seen in previous waves, do you have any indication, you mentioned a couple of weeks, of sort of when this could peak and then start to fall again?
I think it's very hard to know at this point. There's a few unknown factors that are going to contribute to that. There's the impact of these new variants, which are clearly much more infectious. There's a fact that the mobility data from the province suggests that the limitations in movement of people didn't actually measure up to what we saw in prior waves when the lockdowns went into place. So we're really hopeful. We're looking at 1 or 2 weeks before this crests, but I think it's very uncertain at this point.
And I gather it's not surprising, and we've got the the headline up on our screen right now, that the City of Toronto could soon see a spike of cases, perhaps 2,500 by the end of April. I mean, it's a major population center, so to a certain extent, there's some expectation that as you see a surge in Ontario, you're going to see a surge in the biggest city in the country.
Yeah, absolutely. And COVID has this pattern globally. We've seen that it tends to have these bigger surges within urban centers. Toronto clearly has been an epicenter for growth during the pandemic over this past year. And unfortunately, it's also going to be the size of one of the greatest spikes during the next few weeks.
We're going to show in just a moment the number of people who have been vaccinated nationwide, and the 7.3 million people, close to 800,000 have received a second dose, and we're just shy of 20% of the population. Those are good numbers. They're getting better. We're adding about 5% or so each and every week, but not good enough, correct, in order to fight back this rising wave of COVID, including the variants of concern.
Yeah, that's absolutely right. So getting vaccines into arms is crucial, and it's going to be part of our solution over the next few weeks to months of getting these numbers down. Right now, what's really encouraging is the number of people who have at least received 1 dose. We could clearly do better, but the vaccine rollout has improved the last few weeks. However, the numbers we're seeing in the ICU right now are not going to be responsive to that vaccination. There's just too much of a delay. And so, unfortunately, the vaccine rollout itself is not going to help us with our current numbers. It's part of the future solution, but it's not going to help us with what we're dealing with right now.
Will the fact that Ontario and other places in the country, but in particular Ontario, has decided to try and tailor-make the vaccination, so go at at-risk populations in red zones, hot zone neighborhoods, will that start to turn the tide?
Absolutely, it's going to be part of the solution. So what we've seen is the degree of COVID incidence is dramatically different by neighborhood, workplace settings, other social factors. And so targeting the vaccine towards those neighborhoods or locations where there's going to be the greatest case growth will help to reduce the numbers overall. And there's even probably a spill-out benefit. So if you can reduce numbers in those neighborhoods, you can on aggregate benefit everyone because it just reduces spread.
Really appreciate you taking the time today to come on CTV News and talk to us, Dr. Razak. Thank you.
Great to be with you.